Paul Offit is a physician, speaks out against the anti-vaccine movement. He said, it's much harder to unscare patients than it is to scare them. So politicians and celebrities, they have the easy job because they can say what they want online and plant that seed of doubt in patients' minds. And it's up to health professionals to pick up the pieces and unscare them in the exam room. That's why it's imperative that we cannot lose the PR battle online. Because if that happens, we risk losing our influence to those who peddle pseudoscience and those who spread false health claims. How can social media help? Social media gives us the opportunity to tell our stories. The English writer, Harold Goddard, he wrote, "The destiny of the world is determined less by the battles that are lost and won than by the stories it loves and believes in." Have you ever turned on a television to a daytime talk show and they could have a segment on vaccines and autism? And on one side, you could have a health professional, doctor, nurse, someone from public health, and they will have mountains of evidence on their side, but they will speak in a language of numbers, data, and statistics. And on the other, you could have a parent whose child has autism they think may be associated with vaccines. And they'll share a powerful personal story and say things like, "My son is my data." And that story will have tremendous resonance in the court of public opinion. They've done studies on the power of story, and they can overcome preconceived biases. So it's time that those of us in healthcare, we tell stories of our own. Like that time in San Diego back in 2008. There was an infant too young to receive the MMR vaccine, and she got sick with the measles. And the only thing she did was go to a routine pediatrician's appointment and was exposed to an unvaccinated child in the waiting room. Stories put a human face on the evidence that we rely on to teach and treat our patients. And social media gives us a stage for us to tell our stories.